Now more than ever, you need technology you can rely on.
頼れる人ですよね。
I'm a Dell Technologies advisor.
Ich auch.
我也是。
我aussi.
And if you're a small business, we're with you.
We are with you.
Estamos com você.
We want to help.
So we'll be right here.
At home, answering your calls, providing support,
And standing by you every step of the way.
Bye-bye.
For everyone who's joined us in room D, and we have a great session today here. To start off with, we have a panel on anxiety, depression, and entrepreneurship, followed by global connections, which is being put together by Silicon Valley Bank. To the moderating the panel today is BJ Arun, who's also the president of TiE Silicon Valley, and I'm going to introduce Arun to you, and he's going to take over from there. BJ Arun, and most prominently he's known as BJ, was most recently the CEO of July Systems, which was acquired by Cisco in June of 2015. A leader in location-based digital customer acquisition and a multi-channel engagement platform. Arun was a co-founder CEO of Librado, a San Francisco-based provider of complete solutions for monitoring and understanding the metrics that impacts businesses at all levels of the stack. Librado was acquired by SolarWinds in 2015. Pardon me, July was acquired in June of 2018, my bad. Prior to Librado, Arun was a founder and CEO of California Digital, a market leader in the space of Linux-based high-performance computing and related software services. In addition to various rewards and recognitions, Arun was awarded the prestigious Karnataka Rajyotsava Day Award by the Chief Minister of Karnataka, India, in 2004. With that, I'll hand it over to Arun to take the panel over. Thank you.
Thank you, Kumar. Thank you very much for that generous introduction. So am I live? Are you guys able to see me, hear me? I can only still see Kumar.
Yes, I can hear you, BJ.
Okay, great. All right, so this particular topic of anxiety, depression, and entrepreneurship is one which is, I think, very relevant for the times that we are in. I mean, even during normal times, the sort of life of an entrepreneur is hard, right? Because you don't have any stability, you're sort of having to, every single day is a new challenge. But particularly, I think during this worst pandemic that is sort of hitting us, I think this is something that we really do want to get some help, to deal with some of these issues. And just like most people, I too have, dealt with stress in my personal life, in my business life. And I just want to focus on the stresses that we deal with on the business life today. And as entrepreneurs or business leaders or founders or CEOs of company, there are days, particularly in the early times during a company's journey, where we have to worry about how do you make payroll or how do you pay rent? And of course, as the company grows, we then have to deal with how do you scale revenues? How do you manage geographically dispersed teams? How do you deal with board dynamics and VCs? And then, of course, then you also have to worry about exit strategies and things like that. And I have personally found that it's particularly lonely at the top since we have to put on a brave front in front of our team members. And one second. Are you guys able to see me? I mean,
yes, we can see you. We can see you.
Okay. Okay. All right. Yeah. So So I think particularly I think it's something which is different stages of companies have different issues, and as I was mentioning that when you are sort of venture backstage, we're not even able to share our problems with our VCs or board members because then you're at the risk of being perceived as a weak leader, and that's not good either. So I'm going to, at this point, without further ado, just bring in our three panelists today who have been handpicked very carefully for these challenges. So let me start with you, Russell Glass. Russ is the CEO of Ginger. So Russ, why don't you tell us a little bit about yourself, and let's take it from here.
Sure. Thanks so much for having us. I'm incredibly excited to talk about it. Obviously, a topic near and dear to my heart. I am a multiple-time entrepreneur. Started my first company when I was 23 and made basically every mistake you could possibly make as an entrepreneur, including mental health mistakes that I've learned along the way, and sort of tips and tricks on how to handle it. Last company was a company called Bizzo that we founded in 2008 and grew to about 160 people, about 50 million in revenue before selling to LinkedIn. And then I ran the marketing solutions business at LinkedIn. And after LinkedIn, decided that I wanted to take some time off, be dad, really do some thinking about what was next for me, and determined that I wanted to focus on something that needed to exist in the world. And as I was ideating, as I was thinking about that next opportunity, I came across Ginger. And Ginger is an on-demand mental health company focused on providing support to employees of other companies, from small businesses all the way up to some of the largest businesses in the world. And what struck me about what Ginger was doing was both how attached I felt to some of the things that Ginger solved for, but also when you look at the huge supply-demand imbalance out there, the number of people with increasing anxiety, depression, suicidality rates over the last 10 years, compared to the number of providers in the space, people that can actually provide that care, it's shrinking over time. And today we don't have enough providers. So you have these divergent curves, and that's manifesting with people not getting access to care. We have about 50% of US counties that have zero mental health providers within county lines, and that problem extends worldwide. We have 60% of people with diagnoses in mental health world not actually getting adequate care today. And so Ginger's goal is to solve that supply-demand imbalance. And I felt like there wasn't going to be anything bigger or more, a bigger opportunity or more scalable opportunity for me to jump into. And so I joined Ginger about 2 years ago, and excited to be here.
Great, thank you, Russ. Let's move on to you, Dana Udall.
Sure. So glad to be here with everyone today. Thanks so much for the opportunity. My name is Dana Udall. I'm Chief Clinical Officer at Ginger. I'm a psychologist by training. I've been in the field as a clinician, an administrator, a supervisor for 20 years. And I even founded a company along the way to try to provide parents with a scalable solution when their children were struggling with mental illness. So this is something near and dear to my heart. I've been at Ginger for 3 years. And really what drew me to Ginger is what Russ was alluding to, this ideal of providing care at scale. So in a traditional mental health model, you have one client and one therapist or psychiatrist, and that's just not scalable. So what I was really excited about was the opportunity to give people access to care, to catch them earlier through coaching, and to provide care in maybe rural areas or other places where there are no providers. So Ginger has been able to do that. I'm involved in every side of the care team. So that means supervising, providing consultation about care, overseeing our QA program, and making sure that our care is really delivered in a high quality way. So thanks again for the opportunity.
Great, thank you, Dana. And now let's move on to Dr. Atur Turakhia. Atur.
Hi, good morning. Thanks for having me. So I'm Atur Turakhia. I'm a board certified psychiatrist. Personally, I grew up in Los Angeles, as an Indian and South Asian myself. I'm aware of the different culture and stigma that, overall in different ethnicities and cultures that mental health has, but also specifically in this community and the struggles that we face in trying to improve mental health overall. And, I became a psychiatrist because I wanted to join the mental and the physical. I learned through medical school, learned about the physiology and all the ways our mind-body connection works, and then also learned all about the psychological aspects. And so, I've been a practicing physician for about 15 years now. About half of my time was spent at UC Irvine, University of California, Irvine, as a professor there, and did my clinical work treating patients ranging from depression, anxiety, bipolar disorder, attention deficit hyperactivity disorders. worked in kind of the outpatient clinic setting, our hospital setting, and also kind of worn many hats over the years, also besides being a practicing physician, as in organizational structure, leadership, as a medical director, as a training director for future physicians as well. So I've seen a lot that, and I'm really excited that, you know, this panel brings us an opportunity to address a lot of these things in different ways. And so I think, you know, I just, and a quick aside, I'm probably the least entrepreneurial out of everyone, but I have my little thing I've been trying lately. When I was listening to one of the keynotes this morning by Shelley Archambault, and she referenced a book, Grit by Angela Duckworth. And, you know, I think kind of dealing with adversity, we're talking about during times of stress, you know, grit is one of those things. And I've written a book, I'm a big basketball fan, and related to sports. And I think there's a lot of lessons that we learn from sports that can apply to all over. And so I've created a book, Find That Mindset, and the chapters include grit and then also grind, chemistry, and culture. So kind of how do we bring teams together to work, you know, to a common goal. So, and I think just overall in terms of this topic today, you know, some of the things that just highlight how big of an issue is, some of the things that both Russell and Dana have mentioned, you know, I think from the World Health Organization, depression is one of the main causes of disability worldwide. So globally, they estimate about 264 million are affected by depression. And, you know, a sobering stat is that close to 800,000 people die due to suicide every year. So that's about one person every 40 seconds. That's staggering. And in terms of anxiety, the World Health Organization also estimates about 1 in 13 globally suffers from anxiety. So, you know, it's not a small problem, and I'm really glad we're here to find some great solutions and move forward. Thanks for having me again.
Yeah, thank you, Doc. So let's start our sort of session with Russ. So Russ, you know, I know that Ginger services, you know, customers large and small. Can you share some anecdotes about how some of your startups or smaller companies who are your clients, why do they reach out to Ginger, and what sort of help or support are they looking for?
I think there are 3 core reasons why companies reach out. One is they're hearing from their employees. You know, their employees are raising their hands, they're going to HR, they're saying, I need help and I'm unable to find it. I'm calling the health plan and nobody's calling me back, or I'm getting a list of providers that are in network with the health plan and none of them are taking new patients. That's sort of the state of the mental health network today. It's very hard to find covered care. It's even hard to find out-of-pocket care, but super hard to find covered care. So that's one, is they're hearing increasing amounts from their employees. Today, mental health is almost always one of the top 2 things an employee is looking for in terms of a benefit at their company. 2, they've had an issue. So whether it's a suicide or an attempted suicide or some other mental health type of issue within the company, something has happened that they recognize now as, we need to deal with this. That, you know, we've waited too long to deal with it. Something's gone bad, and now we need to recover from it and make sure we have the resources in place to scale. I'd say the final big thing we hear, which is interesting, is that the CEO of the company or someone very senior at the company has a personal experience, either for themselves or for family members, where they can't get care. And they realize personally just how hard this is. They recognize that what their employees are going through is untenable. It's not okay, because if those employees aren't healthy, if they're not functioning at a high level, they're not going to be successful performing for the company. And they then bring that into their priorities in terms of leadership at the company. And I'd say those are the 3 core reasons we see companies reach out today.
In fact, I think I recall reading somewhere that the founder or one of the co-founders of Ginger, he had some experience with a close friend or family member, right? Which prompted him to start Ginger.
That's exactly right. Karan Singh had a family member attempt suicide. Fortunately, it worked out, but it set Karan on a journey towards understanding what are these mental health issues? What causes somebody where you have no sign outward of them struggling to all of a sudden attempt suicide? And And that really led him down this path of founding Ginger and building, what's become a fabulous and interesting company at this point.
Great, thank you. Dana, this question is for you. What are some of the common symptoms that you see in entrepreneurs specifically?
Yeah, there is a lot of variety, but often is the case, we see some themes that generally emerge. To start with, there's research that suggests that entrepreneurs are potentially at a higher risk for developing anxiety and depression. Those are two of the most common concerns that we hear people talk about. And, those are clinical labels, but what that means is that somebody is often not sleeping well. So if they are depressed or anxious, that can be significantly impacting the quality of their sleep. It can impact their mood, their ability to function, even their cognitive ability can decline so that they're not as fast or sharp. Making decisions can become challenging, for example. But some of the other ways that this plays out is this sense of always having to be on. So this sense of hyper responsibility, feeling as though you're at the head of a company, you are a leader. Many times people describe feeling as though they have to be so strong and tough that they have a hard time asking for help. And I think one of the things that I see often is that the skills that actually help entrepreneurs get to where they have gotten actually end up backfiring. So the ability to work incredibly hard, to burn the midnight oil, the tendency to not delegate necessarily, but really identify problems and tackle them, those things are great skill sets. But when it comes to mental health, what we often need is the ability to step away, take time off from work, and actually ask for help when we need it. So I'll give you two sort of quick anecdotes. This was sort of a mid-career executive, somebody who was in his 40s, had founded a company, was feeling increasingly stressed and anxious, having a very hard time taking time off and relaxing. So his sleep was impacted. He was feeling incredibly stressed and burnt out, didn't feel that there was a way out because of COVID. Nothing could really change. So he started talking with some of our coaches. They worked with him on things like mindfulness, meditation, exercising, so that he could decrease his level of physiological anxiety. And what really emerged was his sense of loneliness. This sense, BJ, you mentioned this earlier, this sense of he felt so disconnected from his wife, from his friends, because he had been working so much and felt that he had to keep up this very tough exterior. So that's an example of somebody who is really struggling, and you might not see it on the outside, but the treatment was really about helping him reconnect with those people, take risks, starting to share with them some of his struggles and anxieties so that he started to feel more connected and less anxious. The other person that comes into my mind is a woman who was early stage founder, and she really struggled with imposter syndrome, which is something that we hear about a lot. And that is the belief that I'm not really qualified to be here, or, I got here by chance. If anybody really knew that I wasn't competent, then I'd have to leave the company, or people would find out about me. That is a common theme. And we address that often by helping people look at their thoughts and changing how they talk to themselves. So instead of being hard on themselves and saying, I'm not good enough, or I'm going to mess up in this board meeting, really looking at those thoughts and trying to think in healthier ways. So that was the work for her. And imposter syndrome is something that we hear about all the time, and you wouldn't expect it because these are, accomplished folks that are helming companies, but it is very common.
Great. Thank you, Dana. So, I guess I originally am from, India, and a lot of tech entrepreneurs are from the Indian subcontinent. Many of us have subsidiaries or business partners or teams in India as well. And one thing I can say is that in India, mental health or anxiety, depression, these are very taboo subjects. So there's a certain social stigma associated with this. And unfortunately, even in just the last 12 months, we've had a couple of very high profile business executives, entrepreneurs, movie star recently, they've all actually taken their lives. So, we've had the founder of Cafe Coffee Day, an extremely successful entrepreneur. He jumped off a bridge, 8 or 9 months ago. We had another movie star, a very popular star, a young man in his probably 30s, who hung himself literally 3-4 weeks ago. So, it's really something that we want to make sure we're highlighting, particularly with certain ethnic communities where this is seen as taboo, or there is a sort of stigma associated with this. With this, let's go to Atur. Atur, can you share with us the top 3 signs of anxiety and depression? I mean, how do people even diagnose that they've got anxiety and depression and seek assistance?
Sure, yeah. To seek diagnosis to, should you even go see a mental health professional? What are some of the warning signs? So one of the things you look for in anxiety disorders, there's different types, but some of the things that overlap would be excessive worry. So there's where you have, in one case, where you have maybe a small problem, and then your head kind of turns it into a really big problem. So it goes from a cascade almost, where you're starting with, oh, I was 5 minutes late to this meeting. Oh, my boss is going to be upset with me. Oh, I'm going to get fired. I'm going to end up homeless. Now, just because you're 5 minutes late to a meeting, again, probably don't want to be 5 minutes late, but that doesn't mean you're going to end up homeless. So it's this sequence of events that happens in someone's head, and that can kind of derail their confidence and concentration. Now, physically, people can have symptoms such as racing heart, shortness of breath, sweaty palms, also some cloudy thoughts that happen when people have severe anxiety. So the physical symptoms is another piece. And then a third common piece that we really want to think about is avoidance. So avoidance of the fear or stressor. And that depends on what the anxiety causes, but people with anxiety tend to avoid situations that pique their anxiety. And so in the, example maybe in the corporate world, where someone with social anxiety, for example, who really knows the value and importance of networking. However, because of their anxiety, they may skip networking events, and that will lead to them not being able to go as ahead as they would otherwise, or even while they're there, they're just so overwhelmed that they can't really be themselves, and they come across maybe as nervous or awkward. And so these are some of the different ways that anxiety can manifest.
Thank you, Atur. Next question, let me pose to Russ. Russ, given your experience, what are some of the, what do you suggest that CEOs do to better handle the stress that business leaders are faced with on a daily basis? Russ?
Unmute myself. There are a few things. I think from my personal experience, one is as a first-time entrepreneur, as a young entrepreneur, I found that when things got tough, when things didn't go in the same direction that I wanted them to, or decisions that we had made turned out were bad decisions, I got insular. I kind of collapsed within myself. I found it was hard to talk about those things and bring the team along with those things. And it was a mistake from the standpoint of the more of that I had to take on, I actually made it harder for the company to make good decisions. I made it harder for the company to understand why and where we needed to go next. And when I recognized after the first failure that I had actually a community of support in this company. I had 100 people around me that were actually a wonderful community to tap into. And when I shared the burden, it became far easier. When I was able to be more transparent about what I was concerned about, why I was concerned, and we could have a dialogue, that allowed me to reduce some of those anxieties and stresses. And over time, I've become an increasingly transparent entrepreneur. And this now being my fifth or so startup, earlier stage company, I feel like I have now always an incredible team of people around me to help support some of those tough times. Because as an entrepreneur, you're always going to go through tough times. There's no such thing as this straight line to success. That's one. I would say two, sometimes I think it's hard for entrepreneurs. Dana talked about this earlier, this feeling of I have to be strong for my team. But what's interesting about that is your team has their own anxieties. That your team is dealing with all kinds of things which may be highly stigmatized. And if you as an entrepreneur can pivot toward setting an example for the team and being willing to be vulnerable, being willing to be transparent about some of the concerns you have, it helps the team be vulnerable and raise their hand when they have a need. So one of the mindset sort of switches that I think about is, I'm doing this for my team. I'm sharing what I'm worried about. I'm sharing my anxieties. I'm sharing some of the things that I'm struggling with so that they're willing to share as well. Because it's through sharing that they're going to get help, that they're going to be willing to raise their hand and say, you know what, I could use some support. The final thing I would say is sleep. What I've found as an entrepreneur is if I don't get consistently, and this is me, but if I don't get 7 hours plus of sleep a night, my judgment's clouded, I get frustrated more easily, I can't listen as well, and I find myself being short-tempered, and frankly just don't make the decisions that I make when I have a great night of sleep. And that switch, moving from an early entrepreneur that just worked at all hours and felt like the harder I worked, the more successful I would be, to one that I never think about work when I'm going to sleep. Big change for me. I always make sure I'm clearing my brain of work, whether through meditation or through reading or through some other activity. I put devices down, a solid half hour before going to sleep so that I get really good sleep and I can make good decisions. I find that to be a far more efficient way to run a company than working more hours and staying up super late and just making poorer decisions.
Thank you, Russ. Next one, Dana, let me have you take this. As a clinical psychologist, what are some of the ways you suggest that individuals find treatment?
So I think the answer here depends a lot on culture, as we've talked about. That's one of the major factors, as well as what benefits are available in a company. But I will say, starting with culture, it is really important. We know that many people don't seek care because they think, oh, therapy or psychiatry, that's either taboo or that's not for me, or the provider looks so different that they feel as though they will not be understood. The field is definitely changing. There is a lot more emphasis, and there has been for really the last maybe 10 to 20 years, on cultural competence. So I think that the providers who are going into the field are becoming more diverse. People are more likely to see themselves reflected when they meet with a provider. And it still can be very challenging. So I think understanding what someone's cultural lens is. So for example, for some people, they wouldn't feel comfortable going to a mental health professional, but they might talk to a religious or spiritual leader. They might feel comfortable talking to a family member or friend or colleague. Another place to start often is a medical doctor. So some people would perhaps share with their PCP that they are struggling with sleep, or they're feeling more anxious, or they're having heart symptoms. Like rapid heartbeat, for example, they might share that and get some information from their primary care doctor in a way that is more comfortable for them than going directly to a mental health provider. But I think what's really ideal is if there is a great benefits package, if as an entrepreneur or as a company founder, you have the ability to provide great mental health resources for your company, that's where you can take advantage of those and leverage those for your employees as well. And ideally, a benefits package would include a way to receive help in a discreet manner. So we know that it's hard sometimes for people to go in, sit in a waiting room. There's stigma, right? And so they don't want to do that in person. So if there is a way of accessing help that is through a cell phone or a video session remotely, that can really increase people's comfort level so they don't have to go in and face that stigma to the same extent. So sort of broad answer depending on what the resources are, but I think starting with HR and increasing company resources is a really important thing that founders can do to increase their own mental health and support those in their companies.
Thank you, Dana. So I'm going to start taking some of the questions coming in through the chat sessions from the audience. Now, multiple people have had this same question, and I think it's relevant. So perhaps we could have not just Atur, but all of you chime in on this one. And this is, how do you substitute the value of human, personal, and social connections in an online world that we're currently living in, right? And so we all understand the importance of face-to-face contact or in-person contact and all of that. And all day long, we're just sitting on Zoom nowadays, which is better than nothing, but it's still not the same, right? We're not able to go get a drink with somebody or share a meal with somebody, etc. So Atur, do you want to take that first, and then we'll open it up to Dana and Russ as well?
Sure. I think we first acknowledge that it is difficult and different, and we are social beings. But there are, I think, a lot of things we can at least try to substitute. And again, the physical proximity to others is one of the things that is harder right now. And we talk about there's a lot of terms of social distancing, but I think more appropriate, I've heard some people say is physical distancing, because we want to remain connected to others. And so we're in an age, with social media and technology currently where we are more connected than we have ever been in some ways. We're all, for example, all of us are in different areas, and we are still here together, talking together and sharing our common views and goals and serving other people who are distant. So really think about what matters to you and what are those things that are important, and share those, those interests, those passions with other people, so we stay connected. I think that's the biggest thing, to figure out how we can stay connected.
Thanks, Atur. Russ, you want to go next?
I'll defer to Dana on this one, as she's really the expert here.
Good.
Well, we know that being able to see each other is important, right? So mirror neurons really respond. So that means that if I can see somebody and I'm having an engagement through video, that can be helpful as opposed to over the phone. And yet we're suffering from Zoom fatigue, right? We know that that is a very real thing. People are on meetings all day. So I think taking breaks from social interactions can be really important, or deciding to do phone meetings. So we've been talking about this a lot as a company. So what if we do walking meetings where everyone's on the phone, not on video all the time? So I think it's about being creative. The research suggests that if we're talking about mental health services, for example, that video-based services can be highly effective, in some cases as effective or more effective than in person. So it is really important that we are leveraging these technologies for mental health, but I think they are not the end all be all. And if we can have socially distanced interactions, going on a walk with somebody that's 6 feet away wearing a mask, that's a great way to stay connected as well.
Great. Thank you, Dana. So we're now less than 5 minutes away from concluding our panel. So one of the questions which has been asked by the audience, and I think is a good question as well, is what can individuals do to maintain good mental health? So are there any tips that all of you can share as to what individuals can do to make sure that they're just doing preventive maintenance, right? Making sure that they're keeping the chin up and their mood's elevated. I know exercise, for example, is a great, mood elevator thanks to the serotonins, et cetera. What else can, what would you recommend that individuals do? Dana, go first if you like.
Sure. I would say, Russ mentioned sleep earlier. This is one of the most important things, and having a regular wake time every day has really been associated with positive benefits. So meaning that you may vary the time in which you go to sleep, but having a routine before bed in which you're not on your phone, not sort of exposing yourself to the blue light, but having a restorative time to wind down in the evenings, and then getting up around the same time every morning is really crucial to good sleep, which we know can impact mood and decrease anxiety. So that is one of the things that I think is most important. And typically, coaches or therapists could help with that, but that's something that most people can implement pretty easily on their own as well.
I guess one thing about sleep is that anytime you have anxiety or stress or, big responsibilities, right? I mean, I'll give you my own example. I mean, I could barely get any sleep last night because I knew at 7:15 this morning, we have thousands of people dialing in and all kinds of stuff can go wrong. And, like Zoom links not working or whatever, right? So it's really hard to sleep all the way through 6 a.m. because I got up at 2, I got up at 3. I mean, I just couldn't go back to sleep. So how does one deal with that, especially when you've got stresses coming, right? I mean, it's not something you can just tune off like Russ does every evening and go and get 8 hours of sleep. So how do we deal with that?
I can jump in, or Atur, would you like to answer this one?
You can go ahead.
Okay. So I would say it's all about creating good habits over time. There are going to be nights, certainly, in which all of us, have those sleep difficulties. Russ is sort of an exception. So Russ is a good sleeper, and not all of us can emulate that. But I think it's normal to expect that we will have some disruption in sleep patterns, right? If we have an upcoming event that is stressful, if there's something in our lives that is really creating anxiety or depression, certainly. But over time, building these habits of self-care is really one of the most important things we can do to manage mental health over time. So eating well, establishing regularity in our exercise and sleep routines, that predictability really tends to work well for people. It's hard for entrepreneurs because there are so many times in which, you're filling out paperwork, responding to emails, doing anything late at night. So it does make it challenging. The more we can focus on that, and not 100%, we're not aiming for perfection here because that can set people up to feel as though they're failing or never achieving their goals. but let's say 80% of nights you're sleeping well, that seems like a pretty reasonable target.
And just to add real quickly to that, as an entrepreneur that has in early career struggled with sleep, I would say that one tactic that I found to be incredibly valuable is meditation. So having a quick meditative routine when I wake up at 2 in the morning, I'm having trouble sleeping, a 5-minute meditation can often get me right back into sleep. A breathing exercise that I know is something that helps me, it can be helpful as well. And just knowing, just the knowledge that I have some of these tactics actually helps me fall back asleep. Because you know that feeling of, oh, I'm up, I'm never gonna be able to fall back asleep. Some of that goes away if I have tactics. Because it's like, oh, I'm up, but it'll be fine. I'll do a quick meditation, I'll breathe, and that even lowers the anxiety level and allows me to kind of drift back off.
And I would just add to that,
Right.
I think all those great points that sometimes when you're worried about that ruminating, the excessive worry right before bedtime, if you carve out a time, not right before bedtime, but let's say maybe 2 hours in the evening, hey, I have half an hour, I get to worry about whatever else I want to. This is my time. It's almost like you kind of exhaust that worry a little bit so that when you actually go to bed, then you don't have to use that time when we're lying there and there's no other stimuli, so that doesn't overpower us. So that's one of the techniques that can be really helpful in addition to the sleep, which I agree completely, and exercise.
Great. Guys, looks like our 40 minutes just flew by. So we're already at the top of our panel slot here. So thank you so much, Russ, Dana, and Atur for joining the panel. Thanks also for Deepa Prasad for helping put this together with me. And one request I'll have is that if you could share some materials or pointers or links to materials that our entrepreneurs and business leaders can benefit from, would be happy to share that on the TiE website as well as with our attendees. So that would be very useful. Thank you so much, guys.
Thanks for having us.
Thank you, BJ.